Over to you, Brooke.
Okay. All right. Well, thanks everybody for joining us. Like you said, I'm Brooke Tyler. I'm a social worker at the Adult CF Center at UT Medical Center in Knoxville. Jayne and I are excited to talk to you about transition to adult care and just some things to take into consideration to help ease that transition for you as patients and support systems for patients. So with that, we'll jump right in. Next slide, please. All right, so just kind of from a social work perspective and a general clinic perspective, just a few topics we're going to cover. So transition of care, talking about a few things to help ease that transition into adult CF care from pediatric care, and then moving into more specific topics that will be helpful for patients to know and understand better as they make that move to adult CF care. So that being like insurance, medications, talking about mental health and the importance of mental health screening, and I'm talking about transition with your pediatric care team and your new adult CF team, future planning like college, family planning, work, things like that as you move further into adulthood. Knowing your CF care team and understanding that multidisciplinary approach to your visits, finding community and learning how to utilize online and in-person community resources to connect with others in the CF community. And then just a little tip on communication, just to tie it all together. So we'll get started and go into transition of care. So next slide, please. All right, so transition of care, I just listed 4 topics here or concepts that I felt would be helpful for patients and for family members, guardians, support systems, whoever is in your circle to help with that transition of care. So that would be to understand your care, to take ownership of your care, collaboration, and empowerment. And we'll just kind of go briefly through each of these. So understanding your care, just take time to reflect on that and understand what does that mean to you? What do I know about my care now? What more do I want to know and to understand about my CF care? So with that, just take the time to ask questions to your care team, to your support system, or whoever has the information you're looking for. Get to know your physical health better and know your mental health. And as regarding treatments, understand why your treatments are important and what each one is for, whether that be your vest or oral medications, vitamins, supplements, whatever it may be. It's important to understand what your treatments are and why they're important for you to take. Also understanding the multidisciplinary approach to your CF clinic visits is important, and to understand why each discipline is there to see you and what role they play in your care and how each of those people can help maximize your understanding and participation in treating your CF. Taking ownership of your care. It's really important, especially as you move into adulthood and adult CF care. When you're approaching transition from your pediatric clinic to adult clinic, use the patient, or if you're a family member, guardian, spouse, whoever you may be, if you're active in this person's care, start incorporating them or you yourself taking initiative to involve yourself more in your care, whether that be starting to schedule your own clinic appointments, learning how to get your prescriptions from the pharmacy and calling to get refills, things like that. During your clinic visits, taking charge and taking charge of the communication during your visit, like when you're speaking with your providers and other CF care team members, just to help with this process for your family members, and use the patient to learn to take ownership of your care as you move into adulthood. And collaboration is really important as your CF Care Center. We're on your side and here to work with you to optimize your care, to advocate for you and help in any way possible to ensure that you have the best quality care available. And the best way for us to help you and your support system is to openly collaborate and work together to create a specific care plan that is tailored just for you, your care specifically. And a great way to do this is to, if you have an opportunity to do a transition clinic visit with your peds clinic to meet your adult team before you completely move to a new center, that's great. And if, to start those collaboration efforts then, but if not, making that first initial adult visit and getting to know your team members and, starting to work together and be active with them in creating your care plan. And empowerment. We know this can be a difficult time as you transition from peds to adult care, especially if you've been with your team for quite some time. And so the goal for you is to feel empowered, meaning that you're gaining that confidence to speak and advocate for yourself. It just really ties in with feeling empowered is being able to understand your care, being able to take that ownership of your care and to collaborate with your care team and with your support system and who all is important to your care. And so just taking time to reflect on that concept of empowerment, will be important moving forward, in your journey. Just, ask yourself, what does empowerment mean to me? How can I feel more empowered in regards to my CF care? And if you're a support system person, a parent, guardian, spouse, friend, can ask, how can I help my child or loved one feel more empowered with their CF care as they move into adulthood. And so with that, we'll go into just a few topics that are important especially for that initial clinic visit, and just things to know that will be helpful in managing your care. So we'll go to the next slide, please. All right, so we'll start with insurance, which is a big one. So just starting out, as you go to your new center, it's important just to be knowledgeable of, what your insurance policy is, or insurance policies if you have more than one. Make note of, do I have a commercial policy? Do I have a Medicare policy or Medicaid or TennCare here in Tennessee? And just to note with TennCare, there sometimes can be multiple benefits to that. So like, for example, do you receive SSI or Social Security income? And knowing kind of what that monthly amount is and what that entails. And also with TennCare, just kind of being aware that sometimes around 18 or 21, sometimes coverage can change, or maybe have to reapply for benefits, or maybe nothing will happen, but sometimes they do send letters out. So it's important to kind of be aware that that could be a possibility. I'm not saying it will be, but there's potential for that. So just to, be on the lookout for that. And then with your insurance, it's important to be aware of any like CF medication copays you may have, and starting to learn what those might be, and understanding like financially how that affects you, and letting us know, are you already enrolled in any assistance programs that help with your copays, like HealthWell or Vertex, the Assistance Fund, any of the programs out there. That way we can help with any re-enrollment, or if you need any additional documentation to continue with those. And then also being knowledgeable of those copays is helpful if it does come to the point where you realize you do need copay assistance. If you don't already have it, then we will be able to help you with that. So move on to the next slide. Next slide, please. There we go. All right, so kind of going off of the last slide, piggybacking with this, in regards to your pharmacy and your prescriptions, knowing your medications is really important. This is a great opportunity for you to better understand and take ownership of your care, before your first visit to your adult care center. Take time to familiarize yourself with your med list so you can communicate with your medical providers or your pharmacist or whoever you're talking with talking over your medications with. Write them down, make a list in your phone, anything that can, help you remember. Write down any questions you may have about your medications, about why you're having to take it or what the purpose of it is, any kind of questions, you may have. And then as we talked again, that will make it easier, for you and us to collaborate together to identify any needs for any assistance programs to help with co-pays. All right. And then also pharmacy, make sure to note what your pharmacy is and if you have more than one pharmacy so that they can make sure your medications get to the correct place. All right, next slide, please. All right, mental health. This is a really big aspect of CF care at any CF clinic visit, especially your first visit as you transition to adult care. So just wanted to make note of a few things that you may be asked about, or what to expect, or to talk about, or to fill out. More than likely, you may fill out a mental health screen, which might be like the PHQ-9 or GAD-7. These are great conversation starters and ways to assess mental health and for us to get to know you better and to identify any resource needs or any questions or concerns that you may have. We'll also may talk about history of mental health treatment, whether that be therapy or medication in the past or any other kind of mental health treatment. Also discuss current mental health treatment if you are currently seeing a therapist, taking medications, or any other form of mental health treatment. And, we know this can be a hard time, especially when you've grown to trust and build relationships with your pediatric care team and you've really, built great rapport with them. So just encourage you and your support system or your current CF care team to have those discussions about how you're feeling about going to a new care center and how to best facilitate that transition of care in a way that's comfortable and provides closure for you. And then, just apart from that, just feel free to reach out to your social worker or mental health coordinator if you have questions or need help with referral information or anything like that. This is just a great way to begin that collaborative relationship with your care team and just have open dialogue, for discussion at those visits. All right, next slide, please. All right, so future planning with college. Just really encourage people wherever you're going to consider enrolling with your disability services at your college or university. Some places may call it something different, so you can check into that, but this is just important to have in case of a hospitalization, or if you need to be home with IV antibiotics for a while, or if you need to drop a class or a semester due to prolonged illnesses. This can provide some protections for you as a patient with CF, and your CF care center can probably provide some documentation on we provide letters to our patients to give to disability services at their academic institutions to make sure they have these protections. And also we can provide documentation to help get any financial aid reinstated or recommend it to be reinstated. Sometimes, if you do have to drop classes or things like that, sometimes financial aid can become an issue. So we are happy to help there as well. And with college, if you're planning on living on campus, if you need any like meal accommodations, housing accommodations, feel free to reach out to your CF clinic to get that documentation that you need to make sure you have all you need to be successful as you go on to school. And then if you plan on just going into the workforce, after high school or wherever you are in your journey, same thing. If there's any accommodations that are needed for your job, we can, always help provide that documentation for you. All right, next slide, please. All right, and knowing your care team is really important. Make a note when you go to that first visit, who's on my care team, what is their name, and ask them like, how can I contact you if I have a question? Is there a main clinic line I can call? Is there an after hours line I can call if I'm sick? How do I get a hold of the social worker or the dietitian or pharmacist, nurse, whoever it may be on your team? If you have a question, this can really help not delay your care and make that just a little bit more efficient. So just be sure to make note of that so you'll know who each person is on your team and how you can get in contact with them personally. So next slide. And finding community. Really important just to find people you can connect with that have had shared experiences, and there's different ways to do that. There's a lot of social media groups online, like Facebook support groups or Facebook support pages, Instagram pages, things like that. Online support groups, there's several online free support groups like through CFRI, Attain Health, just as a couple of examples. Check with your CF Care Center. They may have support groups available like online certain times of the month. Or you can even reach out to like CF Compass to locate other resources. Local CF Foundation activities like this one to participate in, to connect with the community. So make sure to, follow them on social media so you can be engaged in their activities. Friend and support, or friends and family support, CF Care Team support. And then if your center has a patient family advisory board, that's a great way to get connected with your own CF center and other patients and your care center staff, for your voice to be heard and to advocate for change in your local CF community. And next slide, please. And then just in summation, communication is key. Just going back to what we touched on in the beginning, understanding your care, taking ownership of your care, collaboration and empowerment, just using those communication skills to do all of that as you transition to adult care and initiate those actions, for yourself and your support system. So, Jayne.
All right, hello everybody. Talk a little bit about nutrition. I am Jayne Hillhouse. I'm a nutritionist with the Adult CF Center at UT Medical Center in Knoxville. So we'll talk about some topics related to nutrition that may come up when you transition from the pediatric to an adult center. First, we'll discuss the use of BMI as an adult when we talk about weight goals, as opposed to what you were used to with using BMI percentiles as a child. We'll talk about healthy eating. I'm sure this has been discussed with your dietitians in the pediatric clinic, but I just want to remind you that this remains very important as an adult and to support a long and healthy life. Insurance coverage for nutritional products. This may change when you reach age 18 to 21. And lastly, at some point, some of our ladies will reach a time in life when you might consider starting a family through pregnancy. So I want you to be aware of the importance of getting yourself ready nutritionally beforehand. Next slide, please. Okay, so and looking at BMI as an adult versus BMI percentile as a child. So as you know, and remember, for each child starting at age 2, weight and height has been tracked on a growth chart. By plotting the height and weight with each clinic visit, the charts show how each child's growth is progressing and how it compares to the rest of the population at that same age. So this is a tool to make sure that each child is on track to reach their full growth potential in both weight and height. Next slide, please. All right, so we're missing a slide here, but all it is basically just showing that a straight calculation that we do for BMI for adults. Once you reach age 20, we don't look at growth on a growth chart anymore because most people by this time in their life have reached their maximum height. So for adults, we just do the straight BMI calculation, and it's basically just weight divided by height, and it gives us a number. An example of that would be like if you're a male or a female with a height of 5'4" and a weight of 137 pounds, the BMI calculates to 23.6. Okay, so in getting to this slide, this kind of helps us figure out what is a good BMI for an adult. But it really depends on figuring out what BMI is associated with optimal health. And for people with CF, research has shown that BMI gets higher, lung function usually gets better as the BMI gets higher. So this particular graph demonstrates that relationship between BMI and lung function. So just to explain how this graph is set up, the red lines represent the females and the blue lines represent males. So the solid lines, the solid red and blue lines show increasing lung function. It goes up as BMI goes up. And there's really a steep improvement in lung function for females as BMI gets close to 22, and for males as they get close to a BMI of 23. And as you can see, even once you get past that BMI of 22 and 23, lung function still tends to go up as BMI goes up. But the dramatic improvement is right around 22 or 23. So this is the best data we have right now for establishing BMI goals for adults. And this is the reason why we give a BMI goal of 22 for females and 23 for males. So you'll hear that when you're in the adult clinic. Next slide, please. Okay, so how does BMI information translate into something useful for you to know? Well, by using this table, you can find your height, then look across to the BMI column of 22 if you're a female, or 23 if you're a male, and it shows your goal weight in pounds. So for example, if you're a female and your height is 64 inches, your goal weight is in the BMI 22 column, which is 128 pounds. Next slide. Okay, so when we talk about a healthy diet, I want you to think about how cystic fibrosis is a condition that causes chronic inflammation in the body. It affects a lot of the organs like the pancreas, the kidneys, the liver, as well as the lungs. So one of the best ways to help reduce inflammation in the body is through a healthy diet. So if you have a long life ahead of you and you want to keep your bodies as healthy as possible. So we just talked about how to figure out a goal BMI and weight as an adult. The calories are still something that we want to make sure that you're getting enough of if you need to gain weight to get to that goal of BMI of 22 or 23, or to maintain it, or maybe you are well above your BMI and you want to consume less calories to help with a little bit of weight loss. So as we look at calories for weight goals, I want to really emphasize consuming healthy calories to achieve those goals. And as I said before, CF is a disease that causes a lot of inflammation in the body. So the choices you make with the foods you eat can really play a role in worsening or improving that inflammation. When looking at your diet, try to limit foods that may worsen inflammation. You can talk about this in more detail with your clinic dietitian, but generally, we recommend reducing intake of things like sugar-sweetened beverages, refined carbohydrates. This is like candy, processed foods with added sugar like packaged cakes and cookies, processed meats like hot dogs, sausages, etc. Trans fats, you may have heard of those. They've become popular lately. Another word for it is partially hydrogenated vegetable oil. Now, these are present in most fried fast foods, some processed foods, and some margarines and vegetable shortenings. So instead of these types of foods, try to reduce those as much as possible, but try to include more anti-inflammatory foods on a daily basis. And these contain high amounts of antioxidants. Antioxidants are compounds in food that help fight chronic inflammation and chronic disease. So some tips are: try to use extra virgin olive oil whenever possible instead of margarine, shortening, lard. Some of the vegetable oils tend to be inflammatory, like corn oil, safflower oil, sunflower oil, etc. Include plenty of fruits and vegetables in your diet. Shoot for 5 or more servings daily if you can. These contain a powerful amount of antioxidants. Nuts like peanuts, almonds, walnuts, and many more. Fatty fish such as salmon, tuna, mackerels in that group. One of the things that can create issues is for some of you that have started working, it's really important to make time to eat meals and snacks. And as Brooke pointed out earlier, if you need a medical letter to give to your employer requesting adequate time to eat, we are there to support you in that. And likewise, if you're going to college and living on campus, or if your school meal plan is difficult to manage, we're there to help you work with your school too on those issues. So we've written letters of medical necessity in some instances. And just remember, whatever your situation in life, if finances are ever limited and you have difficulty with keeping enough food, the dietitians and social workers in your clinic can help you connect with food pantries and other services in your area. Don't be afraid or hesitant to ask for that help. Some CF clinics even have their own food pantries. Next slide, please. All right, so once you transition into adulthood, we all have to navigate a little differently in getting the cost of vitamins, protein, calorie supplements, and probiotics covered. But it really depends on the type of insurance that you have. If you have private insurance, you're probably familiar with the various assistance programs like Live to Thrive, Care Forward, KAZ Care Direct, Engage. These provide nutritional products as a benefit for using their enzymes. These programs continue to offer these same products for our adults, so just as they always have. So, but not all of the programs offer probiotics. So if this is something that you're paying out of pocket for, which can be like $30, $40 a month, then we can look at eligibility for grants that might cover those. TennCare generally covers the cost of vitamins and supplements and probiotics, but they stop somewhere around 18 to 21, and it's really dependent on the plan that you have. So if you have TennCare, and as you age out of coverage, you're likely eligible for some type of grant to help cover the cost. So for example, there's a HealthWell vitamin supplement grant that will cover these costs up to $1,500 a year. So this dollar amount changes sometimes, but at the current $1,500 annual allowance, this is usually enough to cover probiotics on a monthly basis, multivitamins monthly, and usually about 2 servings a day of whatever protein calorie supplement that you use. Next slide, please. Okay. So one of our presenters tonight in the earlier breakout session talked about sexual and reproductive health. In this breakout session, I just want to touch on the nutrition considerations and challenges of pregnancy. When you have cystic fibrosis, there is a potential for complications related to pregnancy, but with proper management and careful monitoring and working closely with your CF care team and your obstetric team, many women with cystic fibrosis can carry a child without significantly affecting their long-term health. Lung function, nutrition status, the presence of diabetes or liver disease are all factors that should be taken into consideration with pregnancy planning. Nutrition in mom is a very important component to the growth of a healthy baby. If you plan your pregnancy for a time when you are in your best health, you're most likely to have a successful outcome. Next slide, please. So I strongly encourage preconception nutritional counseling. We know that this results in better weight gain and heavier babies in our ladies with CF. If mom has a low body weight, this significantly increases the risk for preterm delivery. So for a good start to a healthy pregnancy, we recommend that your BMI be at around 22 before becoming pregnant. Anywhere greater than 19, so like 20 to 22 is really where you want to be. So we recommend 25 to 35 pounds gained during the pregnancy. And this is the same amount of weight gain we recommend for moms that don't have CF, but it tends to be more challenging to gain this amount of weight if you have pancreatic insufficiency. So if your BMI is less than 29, less than 20, I'm sorry, we're likely to recommend a higher weight gain, somewhere probably around 28 to 40 pounds to support the baby's growth. Next slide, please. Okay, so on my last slide, I just want to mention that besides BMI, vitamin status is also very important for a healthy pregnancy. It's a very good idea to make sure that your levels are good before conception. As you know, the vitamins A, D, E, and K are often needed in really high amounts in people with CF. So if you become pregnant, your obstetrician will usually place you on a prenatal vitamin. And a prenatal vitamin is a good thing because it contains iron, which is not present in your CF multivitamin. And also it has, the prenatal vitamin has extra folic acid, which may or may not be in enough amount in your CF multivitamin. However, if you're pancreatic insufficient, if you take enzymes, a prenatal vitamin usually doesn't contain enough of the vitamins A, D, E, and K to meet your needs. So during pregnancy, it's common to continue a CF multivitamin along with the prenatal vitamin, but the number of capsules of your CF multivitamin may be adjusted, and that will be done on your individual needs. Now, I want to give you a word about extra vitamin A supplements. If you're taking one prior to pregnancy, this may possibly be discontinued or changed. Too much vitamin A or too little can both be detrimental to the baby in the very early stages of the pregnancy. So assessing your vitamin A requirements is an important part of pre-pregnancy nutrition counseling. Now, if you're used to taking extra vitamin D that was prescribed prior to your pregnancy, it will be necessary to continue that during the pregnancy as well. We definitely want to keep vitamin D levels up, as low vitamin D in the mom is linked to some complications of pregnancy. And lastly, you need about 1,500 milligrams of calcium daily to make sure that the baby gets what it needs, and it's really going to get what it needs, and we don't want it leaching calcium from your bones to get what it needs to grow. So since the amount of calcium in the prenatal vitamin is not near enough, and there's not any in your CF multivitamin, we want to make sure that you're getting plenty in your diet. And this is another reason to get nutritional counseling before pregnancy. All right, and that concludes our presentation. And so we're up for questions.
Yeah, go ahead. Thank you so much, Jayne and Brooke. That was wonderful. Go ahead, y'all. And if you have any questions, feel free to pop it in the chat and we can share it with our presenters. All right, or if you want to come off mute and ask a question too, you can do that. Just feel free to unmute yourself and share a question.